Good morning. It's Huntington's disease Todd. I was asked the question one time, how can a spouse or caregiver help a Huntington's disease patient? And then how can she or you help yourself? So for today's message, I'm just going to be talking mostly about as a spouse because that's just a relationship that I have with my wife. All the terms could be used for caregivers as well. So the best practices or how to help someone with Huntington's disease is going to vary dramatically because we all act and can be and have symptoms so much differently. With me, I'm a pussycat to take care of. And if you ask Wendy, she would not necessarily agree with that. However, not all people in this disease are pussycats to be dealt with either. So how do you take care of does a caregiver take care of a Huntington's patient? That's the first part of the thing. Give me some space. Too many questions can confuse me, and don't try to understand everything about this disease. That's the 3 points about how you can care, give, or take care of me. And then I'm going to finish it off with how do you help yourself? And helping yourself, means that sometimes you have to get back from the situation. You have to take a little bit of time. You may have to even get out of the house or whatever that involves. But then I say for the spouse, how does she help herself? First off, she has to give herself space, right? Remember the person that you originally fell in love with, the person that you married, the person that goes back 30, 40, 50 years. Remember that as well. Now, in some relationships, they're not as long as hers and mine, so they're not the same type of dynamic. And then understand that everything about Huntington's disease cannot be understood. I've said this before and I'll say it again. With Huntington's disease, what's happening inside of our brain is unlike any other disease. So there's no way to totally understand what every day is going to present, what every day is going to be like when you have someone with Huntington's disease. So for me, as a person that has Huntington's disease, sometimes I just need to have a little bit of time of my own. I need to have some alone time. The way our house is set up, I've said this before, but Wendy and I can separate from each other. I do watch a lot of television, and I do spend a lot of time, involved in that. So sometimes with someone with Huntington's disease, if they're not giving you any trouble, it's best to not kick the bear, not upset the bee's nest or the bee's hive. Sometimes if someone's in peace and they're doing okay and they're not causing you any trouble, just leave them alone. Now, again, I joke a little bit about this because I can have a different take on it because of just how the dynamic of what my current situation is. And sometimes as a loving caregiver, you want to do for me as much as you can, and I appreciate that. My wife helps me in every which way possible. Cooking, cleaning, laundry, making all those things happen. Sometimes when I leave the room, she magically cleans up while I'm gone. Things like that happen. So, but don't confuse me sometimes with too many questions. As a caregiver, questions have to be deliberate and slow when you're talking to someone with Huntington's disease. I think this could go for almost any level of the disease, whatever CAG we may have, because our brain has to have time to process things. One of the roadblocks that Wendy and I ran into just early into this disease was she would spitball questions at me and it would throw my mind into a little bit of a quandary. Now, in the beginning of the Huntington's, it wasn't as bad. I would say 10 years ago, 7 years ago, 8 years ago, whatever, the questions wouldn't be as hard for me to process. Now it is more deliberate that you would ask me questions and look into that part of my brain. Now, don't always try to figure out everything that's happening with me and my relationship with Huntington's disease. Okay? I'm having a whole other relationship in my life with this brain disease. And I actually just thought of that, how that is almost true. You're having a love life with me and you're having a relationship with all the people around you, and I have partially part of that. my love life now, or my brain, is occupied so much with the thoughts that I have inside of my head, just trying to figure life out. Trying to figure out day to day sometimes can be enough of a challenge for me. It doesn't mean I love you less or you love me more or anything like that. It just means that sometimes this disease can make it very challenging for us to express ourselves well. It's mind-boggling, this disease. So as a caregiver helping me out, just understand that you can't understand everything about it. So that was maybe a point for later on, but the reality of it is that with Huntington's disease, you're going to have to give me a little bit of, or you're going to have to give yourself a little bit of a break of trying to psychoanalyze things. Sometimes you can try to overanalyze it. Sometimes we got to slow down. I'm trying to do that now. Take a little break and just remember that this disease is not always something that you will totally be able to figure out. So for yourself, as a spouse, as a caregiver, as someone that loves a Huntington's person, give yourself some space. And remember, it's okay for you to take a break, and it's okay for you to get flabbergasted and exhausted and tired and aggravated. That's the human nature of all of us. But it's also okay for you to walk away, get out of the environment, try to find some, safety and, outside of the conflict. Now, I have heard people that have had, very rocky relationships with the person that has Huntington's disease. Those people, I'm going to suggest you get, help outside of, what you can do. If someone is abusive or someone has, high, desire for alcohol, and there's things, and then also, you might need to get help from someone outside of the relationship, and you might need to get some kind of medication. Fortunately, right now, I'm not on a lot of medications to help alter my mind. My movements are not bad enough at the moment to be on any kind of drug for that. So give yourself some space. Also give yourself some space in your brain. You don't have to understand everything that's going on, and you don't have to be, on top of all of it. Do the best that you can as a caregiver and as a spouse, as a person that loves someone with Huntington's disease. Just give yourself some space and have a break in that. Remember the person that you fell in love with. Remember the person who you married. Remember the person that, and this is to help you just get into a different frame of mind. Sometimes in the heat of the moment and when we get into the passions of our lives, we can lose retrospect on how things were or how things might have been in the past, or the person that we really do love and fell in love with. Wendy wrote me a nice love letter, and for a love letter, it was a Valentine's letter. I'm sorry, it was our anniversary, and she wrote me a letter. I'm thinking about posting that on my TikTok channel. But what I'm saying through all that is, sometimes as a spouse, you need to step back from all of the craziness of it, take a deep breath, and try to remember the person that you originally fell in love with. We're inside of there somewhere. And I do tell you the truth, I think this is the way it is. With Huntington's disease, we can start out at a little level, we can go up on a high plateau, and then we can come back down and mellow out. I think that's how the trajectory of this can be. Although in that middle part, when you're way up in the top and you're dealing with all the calamity of that, it can be very challenging. Don't be afraid, though, to try and have a little bit of, so remember the person that you love. And then finally, I'm going to try to wrap it up on this. Understand with Huntington's disease, you'll never understand everything. You'll never understand totally what's going on. I can't stress enough, what's happening inside of my brain is not like any other disease, and what's happening inside of our brains as a Huntington's patient, you just can't really get a grasp on because it's not happening to you. Right now, for example, I don't have the same emotions that you do. I don't have the same level of love and care and concern that you do. I have a lot more anxiety about all the life issues that we face, all the challenges of the things, doing with and trying to be there for our family. As a father, grandfather, as a husband, my concerns are different right now because I'm really facing the reality of time's getting shorter, and I'm having the anxiety of trying to figure that out. So as a loved one and as a caregiver, as a spouse, remember that we're not looking at a cut and dry A/B analysis of anything. When you ask us about the weather outside, we may be thinking about the fact that we said something that last night that we're still trying to reconcile with. We might be thinking about something that we have to do that we haven't got done. We may be thinking about sometimes, what's going to happen when I can't do the things that I do now. What's going to happen when things change in my life that lead me to not be able to be the same person that I am and the same provider. And sometimes with Huntington's disease, the person that has it doesn't even think rationally at all or doesn't think like you in any normal way. And I've heard some, almost horror stories of how some people act. So look, that's how it goes. Give me space. Too many questions can confuse me. Everything about Huntington's disease can be just too mind-boggling for you to even understand. And for you, give yourself some space. Give yourself some time. Remember the person you fell in love with, and understand that with Huntington's disease, you're never going to totally be able to understand it all. But don't feel too bad about you either. Don't feel bad about how you treat us sometimes. If we get ugly and you get ugly right back, that's a normal reaction in life. And a lot of times I've said this before, the way you react to me doesn't even affect me as much as it really affects you. So that's today's show. That's today's talk. And if it works, hopefully it'll be helpful. And also, this Huntington's disease Todd, I have a YouTube channel. There's going to be some videos down here that you can click on that'll show you some more information. Hey, I only need a few subscribers to get to over, I think it's nearly 1,700. I'm trying to hit that number now. And then also I'm on TikTok. So that's today's video, Huntington's disease Todd. Go to my page and subscribe.